Alright, last video. I'm going to bed because it's about 2:30 in the morning and my brain's about dead. But abnormalities of the immune system. I mean, these are, I'm not going over these in extreme depth because, again, this is just general A&P, but there are some kind of, I think some important, there's just a lot of important application to what can go wrong with everything that we just talked about in the previous videos with cellular immunity and humoral immunity. Um, Basically, remember that the purpose of the immune system is to defend against pathogens, and if those pathogens breach our defenses, then we have specific precision attacks carried out by T and B cells that essentially cause the destruction of those pathogens. Through cell-mediated and humoral immunity, we can activate cytotoxic T. The pretty much the first main cell that's activated in that entire process is to helper T cells from antigen-presenting cells, and then they carry on to dramatically activate cytotoxic T cell activity. Remember, cytotoxic T cells directly kill cells like virally infected cells, tumor cells, and then B cells produce antibodies, and when antibodies bind to specific antigens, that promotes an array of effects that ultimately leads to the destruction of the pathogens that the antibodies are interacting with, like activation of complement and the destruction of the cell membranes of the if it's a virus or a bacterium, or a parasite of some sort. Agglutination and clumping and immobilizing the pathogen and enhancing the phagocytosis of that, or just the overall destruction of that pathogen. Neutralizing toxins, precipitating and weighing pathogens down. All right. So basically, that in a nutshell is a normal immune response. All right. When a pathogen breaches our defense, we react to it, we eradicate it, and then we shut the system off. We shut the response off. All right. Now, so basically, there's really two directions we can go here. We can either say that when it comes to problems with the immune system, there's either a lack of an immune system or there's too much of an immune system. And that's what immunodeficiency means. Basically, immunodeficiency is a lack of a response. All right. And then autoimmunity, this essentially is excessive immunity, and this is more specific than that. It's an immune response to self-antigens, all right? Because a hypersensitivity would be more, there are certain types of hypersensitivity reactions that are excessive reactions to like allergens and pathogens. But autoimmunity is when we lose our ability to tolerate self-antigens and we attack our own tissues. Remember that concept of tolerance. When a naive B and T cell, an immunocompetent naive T or B cell leaves our own antigens alone because, well, we're not supposed to attack ourselves, all right? Now, first what we're going to focus on is immunodeficiency, and we can break immunodeficiency down into two separate categories. We can break that down into either primary or secondary. Primary is when there is a direct natural cause, basically a loss of T and or B cells, and then with secondary immunodeficiency, this is when some other factor is causing your immune system to basically be weak. All right. But let's kind of talk about that. So first, basically, when it comes to primary immunodeficiency, this essentially is going to be some kind of genetic cause. All right, and this basically is when a person either isn't going to develop T cells and or B cells. All right, but either way, if you don't have B cells, you don't have antibodies. If you don't have T cells, you don't have T helper cells, and you pretty much don't have an immune system anyway. So you're pretty much not in good shape here. So this would be a primary. So that would be a primary immunodeficiency. These are like people that you hear about that have to live in like hyper sterile environments. Like the quote unquote bubble people, because Remember, without T or B cells, I mean, you can't really rely on your first two lines of defense because I mean, don't get me wrong, they're useful, but they're not that reliable when it comes to keeping all pathogens out. I mean, we're exposed to viruses all the time. Our cells are constantly put under stress and pressure and are mutating and become damaged over time as well. All right, and without T and B cells to get those pathogens that normally breach our defenses that we're exposed to all the time, we're going to be in trouble. And that's why, like I said, people that do have this condition have to live in just, I mean, like I said, hyper sterile environments. I mean, cleaner than an operating room kind of environment. And if they go outside, they have to breathe, filtered air. They have to probably wear a suit of some sort because I mean, there's so many pathogens that we're exposed to. We just take it for granted because if we have a normal immune system, we just kill them off, right? Like fungi. Various viruses that we can easily eradicate and so on. Okay, so that essentially is a primary immunodeficiency. It's basically a lack of T and B cells. Whereas secondary immunodeficiencies, this is where some outside factor is causing you to basically have a defective immune system. Like, for example, malnutrition. Whether it, malnutrition can come in many ways. Just lack of access to food, digestive system disorders, or more specifically, malabsorption disorders. Like with Crohn's disease, or if you have bad ulcers, and your appetite's not that good. People with eating disorders. You name it. If you're starving, you're depriving yourself of calories, that is going to hinder your immune system. Exposure to various chemicals, like chemotherapy comes to mind when I think of this, because chemotherapy is designed to attack cells that divide at rapid rates. Well, I mean, cells of your immune system are cells that divide at rapid rates, especially when it comes to the development of them in our bone marrow. So exposure to chemicals or radiation, could certainly damage your immune system and cause problems there. Like I said, any kind of damage to bone marrow. If you're doing a bone marrow transplant and you're irradiating the marrow, you run the risk of damaging the immune system there, or not the immune system, but the development of cells of the immune system and so on. All right, and or you can acquire factors that, for example, diseases that cause your immune system to become compromised, like HIV. All right, the HIV virus is what we refer to as a retrovirus, which is kind of a common term. It's typically given to RNA viruses. All right, and again, I'm just keeping this basic in terms of this explanation here. And RNA viruses are what I like to call sloppy. Okay, they're sloppy. They make a lot of mistakes. Therefore, basically what I'm saying is they mutate a lot. Some more than others, however. That's why, there's always so many different variations of the flu virus. Those are retroviruses. Another thing about retroviruses is that they kind of tend to lay dormant. Some longer than others, some shorter than others, but they kind of can remain in inactive state for a little while. That's why they can be just difficult to work with. And then now the thing with the HIV virus, it's the sloppiness that makes it difficult to deal with, because for two reasons. One, that's why we can't really vaccinate against the thing, because it's unpredictable, the way that it mutates and changes all the time. The other thing about it is that that's good for a virus to be able to do that, because that means, because of its unpredictability, basically its biological unpredictability, it evades the specific aspects of the immune response, because if it's constantly changing all the time, meaning if it's mutating all the time, its surface proteins are changing all the time, and our immune system just can't keep up with it. So we can't produce the specific attack against it to just kill the virus off. So as a result, the HIV virus winds up wiping out your immune system, because that's what it primarily targets, are cells of your immune system. And now, obviously, the one to focus on here are T helper cells. All right, T helper cells, because again, remember, 75% of T cells are helper T cells, And once you start to lose those, you start to lose your ability to carry out, you know, strong immune responses. I mean, you can, remember B lymphocytes can be activated on their own. They just aren't going to carry out the strongest response. All right, it's the activity of T helper cells that really allow us to dramatically ward off infections or pathogens. And then eventually, what they're going to do is they're going to look at your T helper cell count, and it's going to slowly drop and drop and drop and drop. And then once your T helper cell count drops to a certain point, then they say you are diagnosed with full-blown AIDS, acquired immunodeficiency syndrome. All right, you acquired the virus, it caused immunodeficiency, and a syndrome, remember, is kind of a cascade of problems. It's kind of it's a concoction of problems. All right, or multiple problems put together. Now, regardless of the cause of immunodeficiency, the problem is going to be what's called opportunistic infections. All right, opportunistic infections. These are infections that people just don't normally get. All right, under normal, with a normal, healthy, working immune system. All right, I mean, like for example, people with AIDS who are infected by the HIV virus and who have AIDS, they don't die. They typically don't die from the virus itself. They die from the complications associated with the condition. All right, they die of, mainly fungal pneumonia. Because fungi are, we're exposed to fungi all the time. Just the way they breathe. They pump out a bunch of spores in the air, and then they travel around. And most of the time, fungi come in contact with their skin all the time. But the acidic nature of our skin and the presence of bacteria kind of will ward it off and help kill it. Our mucous membranes and the IgA and lytic enzymes in our mucous membranes help eliminate fungi. We just kill it easily. That, and when fungi under normal conditions gets in our body is pretty hazardous for most forms of fungi anyway. However, when you remove the cells of your immune system, now all of a sudden you're going to start seeing people getting weird fungal infections, like thrush, like those white patches in their mouth and their esophagus and their stomach. They're going to get bizarre cancers and tumors that you just don't see under normal conditions, like Kaposi sarcoma, which is actually it's not necessarily tumors per se, but it's viruses that attack endothelial cells and cause bleeding, and you develop these these big tumors or chunks of these blood, and then you see these purple lumps on people. It's a horrible thing. But like I said, fungal pneumonia is probably the big one there. But that's what opportunistic infections are. Like I said, they're infections that you don't normally get if your immune system is working fine, because your immune system normally kills off these pathogens that we're exposed to all the time. And without the immune system, well, then you basically lose all defense against pathogens. So that's immunodeficiency, basically just an inability to fight pathogens. And like I said, kind of another extreme with this is autoimmunity. And remember, autoimmunity essentially is a loss of tolerance, all right? And more specifically, a loss of tolerance. When I'm saying a loss of tolerance, I'm referring to self-antigens. Yeah. Self-antigens, okay? So basically what happens then is the immune system recognizes self-antigens as foreign. And you guys know this, it's a very simple concept. The immune system that's the beauty of the immune system, is it's simple yet stupid. Is that basically whatever it recognizes as foreign, it attacks it. And it attacks for the purpose of eradication. And then when the foreign antigen is eradicated, we shut the system off. We shut the response off. Simple as that. However, now like I said, due to the simplicity of that, or I should say the base aspect of that concept, that's why I say the immune system is stupid, because if it loses its ability, if it loses tolerance to a self-antigen, it's just going to attack it and not stop until it's gone. And that causes problems. Now, autoimmune diseases can either be systemic or local. All right, they can be systemic or local. Systemic means that an immune system affects many body systems at once, whereas local, we're talking another example, another expression for local would be organ specific. Okay, like like an example of a very common systemic autoimmune disease is lupus, or SLE, systemic lupus erythematosus. Organ-specific diseases like type 1 diabetes, Hashimoto's thyroiditis, and so on. So basically, just specific organs are attacked. But that's just kind of something to think about. There is that they can run from that. They range from systemic to local, and man, this is the hard part about autoimmunity, is because realistically, to this day, the exact mechanisms are still just. We do have a good vague understanding of it, but there's still a lot of work that's got to be done into truly understanding the causes and manifestations. However, we do know that there are genetic components to this. Typically, with most autoimmune diseases, is if it's in the family history, you run the risk of developing it yourself. There's been a lot of studies done on gene mutations and the promotion of the development of autoimmune diseases. Some other factors related to that, for example, gender kind of plays a role in that. Probably in the U.S., probably worldwide, it probably wouldn't be a stretch to say worldwide. Almost 3/4 of the cases of autoimmune diseases are patients are female. Why? I don't know. So autoimmune diseases are very prevalent in females. For some reason, they're a lot more common in monozygotic or identical twins. It's just bizarre. There's some autoimmune diseases that are more race specific than others. So genetics is obviously a factor in this. Environment is a factor as well, because as we'll talk about in a second, exposure to various pathogens could, for example, trick the immune system into recognizing some of our own proteins as that are similar to the proteins on a bacterium, for example, and we attack both, and that's bad. Bad for the bacterium and bad for us. They attribute to smoking as a contributing factor to certain development of autoimmune diseases. I honestly, don't get me wrong. Smoking in heavy amounts is not good for you, but it's more of a correlation than anything else. And to my knowledge, they haven't identified a specific mechanism with smoking, and that it's just a correlation and just a way to scare people to not smoke. And then obviously abnormalities within the immune system as well, which obviously a lot of that's going to relate back to genetics. With the loss of, with the thymus gland, for example, losing its ability to undergo positive and negative selection properly, or more negative selection, I should say. Because remember, positive selection, where that's where receptors develop, like those MHC2 receptors develop on T cells, and we call it positive selection because we want those receptors to activate a T cell when exposed to a foreign antigen, presented by an APC. And negative selection is when T cells encounter self-antigens kind of deep in the thymus gland, and if they react to them, then we have to eliminate that T cell. Sometimes some T cells kind of slip that quality control process and get out into the system and attack. And in a lot of cases, if a cell, even if a mature, naive, immunocompetent cell does react to self-antigens, there are a lot of cases where there's kind of inherent genetic programs for those cells to induce apoptosis and kill themselves. Loss of those mechanisms. There's a lot of factors associated with the immune system itself that promote the development of autoimmunity as well. All right, but like I said, it's a strong combination of genetics, environment. There's a lot that goes into this. All right, but there are some, like I said, there's some theories related to this. For example, one of them is exposure to a non-normal self-antigen as a mechanism for the development of autoimmunity. Like that, for example, if the immune system ever came in contact with the proteins inside the lens of the eye, during embryonic development, the lens of the eye develops before the immune system can survey it. So as a result, the immune system has never seen the proteins on the inside of the lens. So if something were to happen, like physical trauma to the eye, and if that lens were to become damaged and it broke open and some of those proteins leaked out into the bloodstream, that would cause you to react and basically destroy the lenses in the eye. Another example would be sperm. Blood should not come in contact with spermatozoa because those, males are not born ready to point and fire. Basically, a part of puberty is the hormonal maturity the maturity of the reproductive system during puberty is the onset of developing viable sperm. And so as a result, again, the body has never seen them. That's why the blood and basically the blood and the certain parts of the testes are separated from one another, because that could cause infertility in males if blood were to come in contact with spermatozoon and the testes were attacked. Exposure to thyroglobulins in the thyroid gland is one of the reasons they think causes Hashimoto's thyroiditis, which is it's a condition where you develop autoantibodies that suppresses thyroid gland activity. It causes kind of hardening of the gland, kind of destruction of the inner framework of the gland, the functional framework, I should say, the parenchyma of it. Basically, those thyroglobulins, those proteins inside of those thyroid follicles, again, those are proteins the immune system hasn't seen before. So as a result, if there is any exposure to those, you'll develop antibodies against those follicles, and that could cause again, the destruction of the damage of those follicles, and that will cause your thyroid hormone levels to go down. Once in a while, there may be periodic spikes in the thyroid hormone levels, but in general, it's going to cause it to go down. So Hashimoto's thyroiditis is predominantly, basically a form of hypothyroidism caused by the immune system. So that's, so again, those are just some examples of the body just coming in contact with antigens that it's never seen before, within us. Combination with a hapten. I talked about this in another video, actually. First video. Basically, when I basically said a hapten is a molecule that's too small, all on its own, to basically elicit a response from the immune system. However, if it combines with other proteins or molecules or cells, then all of a sudden we now have an abnormal new molecule, and as a result, well, what does the immune system do? It responds to abnormal molecules, and then that will get the immune system's attention, and it'll attack. A good example of this would be there's a form of thrombocytopenia. Thrombocytes, platelets, penia, thinning of, so basically thinning of the number of platelets. So basically there are certain medications that people take, a wide array of medications people can take. Even basic aspirin can fall into this, where certain components of those medication in the bloodstream by themselves do us no harm. But then if they stick to a platelet, now all of a sudden we've got a molecule that hasn't been seen before, and we will start destroying platelets. Okay, we'll start destroying those platelets essentially that it's sticking to. So obviously the solution here is, and this is typically a fairly correctable situation, just stop taking the medication, and then you eliminate these new molecules, and then you stop reacting to them. Okay, but that's essentially another mechanism. Cross-reaction, or another common expression that's used with this, is molecular mimicry. Mimicry. So there are some proteins on pathogens that can mimic proteins within us. For example, rheumatic fever or glomerular nephritis would be an example of that. This is so there are some proteins on the surface of strep bacteria that are similar to some proteins in our body, like for example the myocardium of the heart and like valves of the heart, especially like the chordae tendineae, papillary not papillary muscle, chordae tendineae, and the leaflets of the mitral valve. So what can happen there is that with the recurrent strep infections, we could eventually develop antibodies against these proteins. But like I said, because they're in a lot of cases they're very similar to our own, we'll develop antibodies that will interact with the strep bacterium, but also cause the destruction, the inflammation and destruction of tissues that also possess those exact same, or similar proteins to us, like hardening of the mitral valve, swelling of the walls of the ventricles, and so on, damage to the kidneys, through glomerular nephritis, and so on. All right, so that's essentially what a cross reaction is basically when pathogens of antigens of pathogens are very similar to some proteins in ourselves, and we react to both. Abnormal MHC molecules could be another example. Basically, again, this, basically with these abnormal MHC molecules, this could cause, just essentially just activation of T cells against, against their own antigens. For example, like with the type 1 diabetes could be an example. This is a Graves' disease where certain antigen-presenting cells could essentially show an antigen that it really shouldn't to a T cell, and then would carry out an attack against it, cause inflammatory responses against their own tissues or destruction of cells. Lack of suppressor T cells are another example as well, where we have to be able to kind of modulate the immune response by shutting it down, or preventing T cells from just getting, like for example, cytotoxic T cells from just getting a bit too active, or B cells from getting a bit too active with antibody production. So basically, again, that's something that's kind of been talked about with type 1 diabetes as well. Formation of immune complexes. This is essentially when an antibody binds to a pathogen. That's what we call the antigen antibody complex, or an immune complex. However, some of these immune complexes basically could get stuck in certain areas and then activate complement and then cause inflammation and damage to certain areas. For example, rheumatoid arthritis is a goofy one, because with rheumatoid arthritis, one of the things that happens there is that people actually develop an antibody against an antibody. So basically what happens is people develop IgM against IgG. So then what happens are these antibodies kind of stick together. And then what happens are, so then this goofy immune complex gets stuck inside, in the capsules surrounding joints, and then what happens is that's going to start causing some very severe inflammatory responses. There's going to be a lot of recruitment of macrophages, activation of complement, because we've got IgM and IgG involved. And then that's going to just start slowly causing the massive swelling and destruction of capsules around joints. And I mean, if you've ever seen rheumatoid arthritis, it's a horribly crippling problem. Another one, lupus. Lupus is also a formation of immune complexes. basically causes of lupus are not well understood. I mean, there's obviously some genetic factors. Most cases of lupus are female. There's certain ethnicities that are more prone to lupus, like certain European descents and like the Latino population and so on. Um, but basically, with lupus is a pain to deal with because with lupus, this is essentially when we react to the nucleus. Again, this is essentially when we react to chromatin in the nucleus of cells, and then we form these complexes in tissues, and then we start activating complement inflammation, seeing a pattern here. But the problem with lupus, because it's so vastly systemic, is that it can be very difficult to diagnose, especially if we don't know the family history of a person. It can be very difficult to diagnose because a person could come in showing, many different signs and symptoms. But yeah, it can be certainly a challenge to deal with. And basically the kind of one of the deals here when treating autoimmune diseases is, eventually what you're going to wind up with, and again, I know I'm kind of overgeneralizing here, but eventually one of the treatments for this is suppression of the immune system. And then now let's picture this for a second. If you start suppressing the immune response, well, now what? All of a sudden, now you have no immunosuppression, and you can be more susceptible to opportunistic infections. But that's in a general sense is autoimmunity and immunodeficiency. I'm not talking about hypersensitivity reactions associated with this, just because I think that's more of a pathophys topic. And I will save that. I should actually get to that one of these days. But that's essentially the immune system gone wrong with immunodeficiency and autoimmunity. And good night, everyone.